You're good to go.
Okay, thank you. Good afternoon, everyone. This is the Grey County Long-Term Care Committee of Management meeting at 1 o'clock on October 3rd. We'll call the meeting to order, but we do not have quorum yet. So for any members of the public that may be joining us, we won't be commencing any business until quorum is obtained. Thank you. Sarah, how many, we need 2 more members to have quorum? Now 1 more with the warden. Afternoon, warden.
Through you, Mr. Chair, that is correct.
Thank you.
Mr. Chair, just to confirm, we wait 15 minutes. If no quorum is achieved, the meeting is adjourned.
That's correct. That's my understanding, Member Burley.
So I assume it's customary that the warden tells jokes for 15 minutes?
So this guy says he has a tremendous fear of elevators. But then he says, but that's okay. I'm taking steps to get over it. Steps to get over it. That's about as good as they get, folks.
Through you, Mr. Chair, I do apologize. I did not include Councillor O'Leary in my initial count. He snuck by me there. I believe with 4 of the 7, we have our 50% plus 1, and we should be good to proceed with the meeting.
All right, thank you, Sarah. With that, we will proceed. We have, just to remind members of the committee of your obligation to declare a pecuniary interest or an interest. Seeing nothing, if anything should arise, you may declare it at that time. We have no delegations today. Our first report is the LTCR CM 15-22 regarding the long-term care director update we received for information. Can I have a mover for that, please? Moved by Member Burley and seconded by Member O'Leary. I believe, Jennifer, you'll be taking this one.
I will. Thank you, Mr. Chair. Good afternoon, committee. Nice to see you all. We are usually a morning meeting, so I had to remind myself to say good afternoon. I am sharing this update, this director update of a number of updates and information since our last meeting. And it is fairly lengthy, so I'm going to just try to hit the high level update. And if I miss something and you have questions, happy to discuss those at the end. So we continue to be ensuring that we have strong and consistent infection prevention and control measures, and are working through the requirements of the Fixing Long-Term Care Act regulations updates. And we are still managing a number of fronts on the COVID-19. So with the COVID-19 update, in mid-August, the government released Ontario's plan to stay open, a health system stability and recovery plan. And it's a 5-point plan, and there's details outlined in the report. Following that, the Ministry of Long-Term Care released a memo outlining the role of long-term care homes in this plan. And there is a number of items that are directly impacted to long-term care. A couple of those that I'll just highlight is the returning of beds that had been set aside for isolation purposes, returning them into the kind of traditional bed count. Also is short stay convalescent and short stay respite care programs, but those items don't impact our 3 homes. There was another update memo on August 30th from the Ministry of Long-Term Care, and it was actually a pretty significant update that talked a little bit more in detail about the pandemic-related isolation beds returning into traditional use, some funding announcements for specialized supports and services, additional occupancy funding reminders, and some more information on provincial initiatives around staffing and health human resources. Finally, at the end of August, an updated version of a standard operating procedure and fall preparedness checklists were released to long-term care homes, and the teams in all 3 homes have been working through those updated documents to make sure we are ready for the fall flu season, prepared for outbreaks and other infection prevention and control items. In a COVID-19 outbreak update throughout the summer, all 3 homes managed COVID-19 outbreaks. Currently, Lee Manor is still managing a COVID-19 outbreak on 2 South and home area 1 South. So there wasn't much downtime in terms of COVID-19 within the long-term care homes. Vaccination update. In the report, there is a chart summary outlining our COVID-19 vaccination rates. In July, the Associate Deputy Minister released a memo regarding second booster doses, and the eligibility criteria is listed there, and a high percentage of our residents have all received that vaccination. Following that, and most recently, has been an update of the availability of the bivalent vaccination, COVID-19 vaccination, and it became available last week. I'll just open another document so that I can share some information on that that's not reflected in this report. So in Grey County, the COVID-19 immunization policy has been updated, and Grey County's long-term care department will maintain the mandatory 3 doses of COVID-19 vaccination as part of an employment requirement for all staff. It's also a requirement for students, support workers, volunteers, and designated care partners. Any dose after that first 3 doses of the primary series will not be a requirement of employment and is considered a personal choice. We maintain our commitment to giving everyone all of the opportunities to make an informed decision on what is best for them. And so we will continue to offer vaccination clinics on site for all residents, all team members, all designated care partners. So they'll be readily available on site. We will provide opportunities for one-to-one education and discussions about what's right for each person, but we will not be mandating any dose be after the 3rd dose for that list of individuals. So that's the newest update there. Regarding active screening and surveillance testing, we do continue with daily rapid antigen testing for all staff, students, support workers, volunteers, designated care partners, and general visitors. So anyone coming into the home, we have an every shift or every day rapid testing requirement. On average, across the 3 homes, 2,000 rapid antigen tests are completed on a weekly basis. And we do continue to successfully screen individuals who do have COVID-19 and prevent them from coming into the home. So it is still a worthwhile strategy. Visitors and family update. All 3 homes continue to offer a variety of visiting options through our Color It Connect program, which includes virtual, indoor, and outdoor visits. On September 8th, we held a virtual family meeting to provide information on the recent ministry updates, our fall preparedness, and the change to the accommodation rates, which we'll discuss a little bit. This is a wonderful opportunity that I'd like to share from Grey County Long-Term Care. Grey Gables was invited to participate in a care partner video produced by CLRI, which is the Center for Learning, Research, and Innovation, along with Briere. And the production team was on site on September 7th. The video will include interviews with myself, with the resident family services manager, with residents, designated care partners, and staff. And the video will be released in late October, so stay tuned for that. I may have had a sneak peek, and it's pretty fabulous. So excited to be highlighting the Grey Gables residents, families, DCPs, and team. Infection prevention and control, a number of updates, some of which I've mentioned already with the COVID-19 IPAC checklist. Public Health released an updated COVID-19 self-assessment tool, and the audit tool is designed to help IPAC leads in long-term care homes assess how our IPAC practices are meeting the minimum IPAC requirements under the new legislation. So we're working through that. On August 31st, the Ministry of Health released an updated management case and COVID-19 guidance document with relevant information for our homes, as well as an updated screening tool. There were no changes to the return to work measures for those who have symptoms or test positive. Workers who are close contact with individuals can test positive can return to work without isolating, provided they have no symptoms and follow additional precautions. There's also greater clarity as to what constitutes a high-risk exposure that would make a worker a close contact. And it's just important to note that all of these details and information are necessary as we work through the phasing out of pandemic and into how we manage infection and infectious diseases as a part of normal life, as opposed to part of pandemic life. I would like to highlight that Advantage Ontario invited our very own Dana Leach, our clinical specialist, to present alongside a clinical leader from Simcoe County on an infection prevention and control focused webinar in September. This webinar provided an overview of the new IPAC requirements related to the Act, as well as how to outlining how to have a strong IPAC program and the day in the life as an IPAC lead. So thanks, Dana, for taking on that opportunity. Recovery and wellness. All three homes participated in the September corporate staff picnic at Grey Roots. In addition, food and beverages were also provided at each home for staff that weren't able to attend the event at Grey Roots. And by all accounts, it was a great day. We've also committed to releasing a quarterly wellness newsletter in our support of highlighting the importance of work-life balance and overall wellness for our team members. The third quarter newsletter was released last week, and it promotes information about our employee assistance program, wellness tips and resources, Color It Spirit photos, and each home highlights Color It Your Way stories for team members to see. Number of financial updates. The Ministry of Long-Term Care released information related to physician compensation and physician on-call program, and those details are highlighted in the report. On August 30th, the ministry released documentation and policy to transition the PSW permanent wage enhancement to be permanently incorporated as part of employees' base salary. Early September, there was an update related to funding for COVID prevention and containment. And finally, at the beginning of September, on September 1st, the province announced an increase to the co-payment of rates for basic and preferred accommodation in long-term care. And as per the Act, our homes provided 30 days notice to all residents for that increase. The Fixing Long-Term Care Act update, highlighted here on August 18th, the ministry released new inspection guidelines for long-term care homes. These inspection guides replace the previous 31 inspection protocols, and these have been consolidated into 23 Fixing Long-Term Care Act-based inspection guides. And they're bulleted here, and we're working our way through that change. On August 31st, Bill 7 was passed and received royal assent. Some highlight of updates for Grey County related to the Fixing Long-Term Care Act. The clinical leaders, so the directors of care and associate directors of care from Grey Gables and Rockwood Terrace, have completed their IPAC certification, which sounds is a quick and easy thing to say, but is a huge amount of commitment and work for our leaders who are also working full-time plus supporting long-term care homes. So congratulations to those leaders for that accomplishment. Regarding the training that's required for medical directors, our medical directors in the process of completing that. Regarding emergency planning and preparedness, we are continuing to consult with all of our vendors and emergency service partners to implement a letter of understanding, and that's required under the Act. And all of our teams are working with Point Click Care and Think Research on implementing additional clinical support tools in efforts related to palliative care and end of life. Partnerships continue to be a very key and important part of the work that we do in long-term care. We continue to have partnerships regionally as well as locally. The Grey Bruce Long-Term Care Committee and healthcare partners continue to meet monthly, and as we move into fall, we're increasing that to twice a month. Recently, this is a nice highlight to share with the group. The County of Grey assisted 19 long-term care homes in Grey and Bruce with the onboarding of STL diagnostic imaging. This partnership provides accessible diagnostic imaging and a timely patient-friendly approach right on site at each long-term care home. So what this means is residents who may have had to go to hospital for X-ray and diagnostic imaging can now have that on site at their long-term care home. So it sounds like maybe not a big thing, but in terms of relieving some of the stress on the hospital system, this is a big deal. 19 long-term care homes, almost 4,000 long-term care residents who now have access to this kind of diagnostic testing in long-term care. So it's a great story. We continue to be thankful for the support from all of you, from the CIO, senior management team, and our partners in Grey County. And that is a very lengthy update. I think at one point we had decided that we'd had 11 ministry updates in a 5-day period. So lots of information to go through, and happy to take any questions if there are any.
Thanks very much, Jen. I'm sure there'll be some questions after that lengthy report. Committee members. Well, I'll start it off. Jen, I had a question in regards to the new Long-Term Care Act, and as far as individuals having to move out of hospital beds, how is that going to specifically affect our area when there are waiting lists, I think, for all of our homes? And would they have to move out of Grey and Bruce County? I think it's 70 kilometers. Can you just share with the committee your thoughts on that, please?
Sure, thank you. Through you, Mr. Chair. So that is, what you're referencing is Bill 7. And we have, just last week, we heard an update from Home and Community Care, which was formerly known as CCAC. And if I start to get this wrong, I hope someone will jump in and help me. So we're all just kind of working through the details of this. So my takeaway from that overview of how it will work from Home and Community Care is that there is no intention to force someone to go to a long-term care home against their will, without their consent. So the bill does allow for that, but all measures will be taken prior to that. So the care coordinators that work for Home and Community Care will be in active discussions with patients in the hospital who meet the criteria of needing to be transitioned to long-term care. If someone only has one a long-term care home on their list, the care coordinator will meet with the individual and or their family, their substitute decision maker, and go over the other options for them within a local geography. So the Home and Community Care group is making a short list of long-term care homes that have shorter wait lists, and then helping people to tour, get more information, see these other homes as an opportunity. They don't have to make them their first choice. They can continue to have their one place as their first choice. If they can choose one of those other options with a shorter wait list, they will not be, my understanding is they won't be subject to the additional fee, that additional daily fee, because they'll put application to one of those homes with a shorter list. When that room comes available, they'll be contacted, have the opportunity to move, and won't then have to be subject to any of the additional fees at the hospital, that additional $400 per day. My understanding is if there is no interest in adding any other long-term care homes to their list, they won't make any decisions even outside of a geography. That is when they're eligible for the fee to be applied. So it won't just happen overnight. There'll be lots of discussion. The hope is to help people transition to long-term care when they need it, and find an option that works best for them, that may not be their first choice, but is still within a reasonable geography.
Thanks, Jen. Now, will these individuals that are in the ALC beds, will they move other people down the queue that are maybe being assisted at home but meet the criteria? How does that waiting list?
I think that's a question I need to take back and can circulate an update to committee. I haven't read that section recently enough that I feel confident to give an answer on how that criteria is being established and whether one crisis bumps another crisis. Okay.
It would be a shame, because there's a lot of families out there that are in crisis, but are making looking after their loved ones one way or the other. So, anyways, thank you. Other questions from committee members? Warden, go ahead.
Thank you, Mr. Chair. Jennifer, you talked about STL diagnostic imaging. I just looked up their website. I was trying to figure out what exactly that was, but I can see that it's like a mobile imaging for X-rays and for ultrasounds, which is exciting news because that's huge for people who have limited mobility. But what exact role did we play in this onboarding with the 19 member agencies?
Sure, thank you. Through you, Mr. Chair. Dana, could I put you on the spot to do a high-level overview of the process? And I'm sure Dana will be humble, and so I will say that she took a lead role in supporting this work.
Well, and thanks, Jen, and through you, Mr. Chair. So to give you a sort of a description, we did have some mobile X-ray in place prior to the pandemic. So there was already some groundwork at play. Unfortunately, as a result of the pandemic, there were a variety of factors that impacted our ability to get that timely X-ray. We do need residents who come into a long-term care home are required through the regulation to have chest X-ray to rule out TB, for example. So as well as not only as Jen talked about our resident, the challenge of going to hospital, it can be very stressful, but it can also be very costly. The transportation required to head to hospital and come back using resources that are already challenged. So what that required was reaching out to companies to see would anybody be interested. STI was a company that is around our periphery in Grey Bruce. we had to get a few people on board and interested. So we had to sort of put a letter of commitment of a few other care communities. Then we had to work with the Ministry of Health to ensure, because these are independent healthcare facilities, IHF, you'll see some of these popping up, but in terms of ensuring that there is that it's accredited, etc. We also had to reach out to our hospitals to ensure that they didn't feel we were competing with the process and that they were also on board. So reaching out to a multitude of partners and then signing on some agreements. And I believe there was a signature from our warden as well for our part, or at least certainly from the County of Grey to make that commitment. So we needed all of those partnerships on board. And then it was establishing some processes with our medical directors and teams. So it is a bit of a process, but they're coming to the area because we were able to engage more than just our three, but the others, and it's a good return on investment as well for an independent healthcare facility. So I hope I answered your question.
Yeah.
Thanks, Dana. Any other questions? Jen, very quickly, one of your attachments in your report was in regards to the new rates that are available or that are being set for long-term care. Am I reading it right that private costs more than public?
Oh, thank you. And through you, Mr. Chair. So to answer that, so private is the level of preferred accommodation. So there's semi-private is one level of preferred accommodation and private is another level of accommodation. The document has a number of criteria under private. So depending on the year that the resident moved in, the rate is staggered to make it extremely complicated to track. And
Okay.
Yeah.
So when we don't have any basic accommodation, which is the old ward system, right? 4 people in a room, we are all semi-private. So do we charge the basic rate or the semi-private rate?
Every long-term care home must have a percentage of basic accommodation. And Karen, I'm going to look at you. I always get it mixed up if it's 60-40 private to basic or 60-40 basic to private.
I think it's 60-40 basic to private.
Yes. So regardless, thank you, regardless of whether it's 2-bed or a 4-bed, 60% of our semi-private spaces are rated as basic accommodation. And in the redevelopment and the design plan for Rockwood Terrace, the ministry has issued an incentive for a 50-50 split. So 50% of the spaces are basic accommodation, which is in order to have the subsidy and a rate reduction applied, the individual must be living in a basic accommodation. So it opens up that more options for people to have a rate reduction application.
Okay. Thank you for that. I mean, there's certainly significant revenue differences between the private and the basic. So thank you for that explanation. All right. All in favor of the director's report? That is carried. We now have the LTCR CM 1622 regarding the long-term operational report from June 15th to June 15th to August 14th, be received for information. Can I have a mover, please? Moved by Warden, seconded by Member O'Leary. Are we going to go through in order, Jen?
If I might, I'll just tell you the order.
I think it's Shannon, isn't it?
So we're going to kick it off. It'll be Dana, and
Okay.
then Karen, and then Stacy, and then Shannon. And they're each just going to give a summary of topic in the report.
All right, we'll turn it over to Dana.
Thank you, and through you, Mr. Chair, I'm really pleased to provide you with an overview of our quality portion of the operational report. And you'll see from that the publicly reported indicators on today's report are from the fourth quarter, which we previously reported on at the last Committee of Management. So unfortunately, at the time of submission of this report, we hadn't yet received the Q1 data from CIHI for April to June, but stay tuned and we'll pass that on to the next meeting. But I am really pleased to share an exciting new program that our Grey County Homes are implementing with our pharmacy partner, and it's called Boomer. And Boomer, it stands for Better Coordinated Cross-Sectoral Medication Reconciliation, and hence why we went with the acronym Boomer, or they did indeed. So it's truly a medication reconciliation program that improves medication safety during resident move-ins, and it supports this significant transition in care where the risk for medication errors can be at its highest. The program helps to identify before residents even move in any discrepancies in medication from either the hospital, if they're coming from hospital, or their home, or if there's discrepancy from the family doctor or nurse practitioner, ensuring we have the most up-to-date and accurate medications for a resident upon their arrival. Often the time from those admissions, and as you've already alluded to, Mr. Chair, the wait times are significant. So some of the initial applications we get, their medications there can be many medication changes. So the program has proven to reduce medication errors, polypharmacy, which is where a resident can be prescribed many different drugs for the same ailment, some of which can negatively impact one another. And it can also reduce medication delays while we wait for meds from our pharmacy provider, and overall inefficiencies. And so more specifically, the Boomer program gathers each resident's medication history from a variety of sources. So it could be their primary care physician, their resident's previous community pharmacist, and it gathers the medication from conversations with the resident or their family. So perhaps, and here's where sometimes some of the challenges come in, where maybe a resident decided only to take half their pill versus a full pill that was prescribed, or made the change to take their pill at bedtime rather than the prescribed morning because it made them drowsy. So we really get an opportunity through the Boomer program to see the full picture, not just from what comes on in paper, but truly interacting with all those partners in care. Then the pharmacy, the CareRx Boomer pharmacist, leads a trio call, and that he brings or she brings all of this information together with to a call with the pharmacist, the nursing staff from the home, and our home's physician to finalize those orders based on all the collected information. So that process saves both nursing and physician time. We're not doing a back and forth. It's that pharmacist who is the expert in the medication, aligning with our home and medical director. But more importantly, it ensures the most up-to-date medication orders, promoting working together, and ultimately providing the safest medication administration for our residents. So it's best practice, it's proven research, and we have got all of our homes on board and have just received feedback today about the process. So we are excited about it going forward. And I will pass that on to Karen.
Thanks, Dana. Any questions from committee members around Boomer? Not seeing any. Okay.
No. Can you repeat back what Boomer stands for? No.
Not even to try. All right. Sorry, Stacy next. Karen. Floor is yours, Karen.
Thank you, Mr. Chair, and good afternoon, committee. I'm just going to update you briefly on the outbreak situation across the 3 homes during the reporting period. As you can see by the report, both Grey Gables and Lee Manor had a suspect outbreak in early July. Suspect outbreak means they had at least 1 positive case in a resident, and were put into outbreak just in case there were more residents. But luckily for the 2 of them, that wasn't the case. So they were very quickly had the outbreaks declared over. Rockwood wasn't quite as fortunate. We had 2 outbreaks during this reporting period. The first one started in July and involved 3 residents and was declared over on July 19th. And the second one commenced on August 3rd. And at the time of the outbreak, it was still going on, but I am happy to report now it was declared over on September 1st. It did affect the 23 residents, as was listed in the report. And we also went into a second outbreak on the opposite floor on August 20th, and it was declared over on September 7th. For the third floor outbreak, there were 30 residents that were affected, including, unfortunately, one death. And currently, the Manor, as Jen mentioned previously, has 2 of their home areas in outbreak. So lots of activity over the summer and into the fall related to outbreaks.
Thank you, Karen. Any questions of Karen from committee members? Okay, I've got a 50-50 chance here. I'm going to go with Shannon. No, okay, Stacy, go ahead, please.
Sorry. Thank you. And through you, Mr. Chair, I'm going to highlight the severe weather that we experienced that resulted in some damage and repairs at both Grey Gables and at Lee Manor. So the weather is something that we routinely monitor in all of our homes because it helps us anticipate any potential safety concerns and also gives us an opportunity to practice and review relevant procedures and ensure that we're prepared. So there were 2 separate occasions during the reporting period where severe weather impacted our region. We had a severe weather warning, and then on another day we had a tornado warning. And certainly with these types of warnings come with a variety of different risks, including damaging winds and heavy rainfall and lightning. And in the case of Grey Gables, it was the heavy rain that caused flooding damage to their tenant space. And due to the design of their roof and the window well that has an exhaust for the air conditioner in it, the water entered the building. So they immediately cleaned things up and made some repairs and temporary solutions while they're waiting for more permanent work to be done on the window well. And then at Lee Manor, we also experienced some damage related to the storm that blew in on the evening of July 11th. And parts of Owen Sound experienced a brownout through the night that stemmed from lightning. And this resulted in a drop in voltage. I'm going to refer to my notes so I get this right. It resulted in a drop in voltage in our electrical supply, causing some of our equipment to work harder, which then damaged the power supply to one of our washing machine units, as well as the motor and the digital controller that supports one of our air handler units. So repairs were necessary, but there was no impact to the service delivery to our residents. And we're currently looking into further prevention measures moving forward.
Stacy, is that an insurable type situation?
I think Marcus, I'm not sure. Marcus did have a question for, there he is. If that's
Hi, Marcus.
okay.
Hello, through Mr. Chair. We did consult it, however, with the premium and the value of what was damaged and everything like that. It wasn't something that we were able to say that was beneficial for us, especially with year over year our premiums increasing as they are just due to us. So yeah, it was deemed better to pay out of pocket for ourselves.
Okay, thank you.
All right.
Any other questions for Stacy from committee members? All right, Shannon, you're up.
All right, thank you. And through you, Mr. Chair. In true Grey County long-term care fashion, we have many Color-It stories to share day in and day out at all of our homes. I'd like to highlight just a couple that have represented Color-It community, care, and relationships. At Lee Manor, it was in sadness and loss that the team pulled together to honor 2 of their team members who had unexpectedly passed away. 2 butterfly plaques have been placed in the memorial tree in the home that represent the light and beautiful souls of these caring individuals that touch so many lives. At Grey Gables, I'd like to highlight and recognize one of our amazing staff members who volunteered her time to get the pond in one of our gardens up and going. So many residents and visitors and staff are enjoying the beautiful water fountain and love watching the new goldfish. At Rockwood Terrace, they joined in on Durham's 150th anniversary by participating in the homecoming parade on July the 2nd. The team prepped the float ahead of time, and the residents were happy to join the parade by following in the bus behind the float. Everyone had the best time, and it felt great to be part of the community celebrations, especially after the overwhelming community support Rockwood has received over the past few years. And thank you very much.
Thank you. Any questions or comments, committee members? All right, all in favor? That is carried. All right, we have, I think, our closed session. Committee of Management does now go into closed session regarding the long-term care staffing report for January 1st to June 30th, 2022, pursuant to section 239, sub 2 of the Municipal Act 201 as amended, and regarding personal matters about an identifiable individual, including municipal or local board employees, and labor relations or employee negotiations. Can I have a mover for that, please? Moved by Councillor Burley and seconded by Councillor O'Leary. All in favor? That is carried. Sarah, you'll let us know when everybody has been removed.